I know quite a bit about the British system and the Canadian system and the European system.
Let's talk about those.
Different as a group. I heard one of your callers say today that it was the best healthcare system in the world. But for instance, I know in cancer survival, there's no country in in Europe that has higher cancer survival rates than we do. And I think a lot of that is because they are driven by a process where you don't have as many specialists, you don't have as many alternatives, you don't have as many options, and I believe that applies to the French system as well. I know the doctors occasionally go on strike in France, so there must not be total satisfaction with the French system.
Do you see anything in the...
I don't want a system, by the way, where the doctors go on strike.
Do you see anything in the Canadian system that you like? It's being held up as something to criticize, but in the past, people have looked to Canada as being a place where people can get prescription drugs, for example.
Well, people get prescription drugs here. They get more prescription drugs. If you have health insurance here, you get the cheapest prescription drugs in the world, and now most seniors have access to that. And we sort of had stopped that discussion of Canada and Mexico because we figured out how to make the competitive marketplace work for people. I think in any system, and I believe the government-run systems have some focus here on just the initial visit. You know, and we need to get people to where their initial visit with the doctor is not at the emergency room. That's why we need to get people access to coverage. And my understanding of most of these government-run systems in Europe and Canada is that you usually can find out what may be wrong with you. It just takes forever then to do anything about it. You know, early detection of cancer. We had a news conference yesterday with 4 members of Congress who were cancer survivors and talking about the various detections of cancer. Early detection of cancer, you have a much better chance of survival in the United States than you do in any European country, and certainly than you do in Canada or Great Britain, because we can get to specialists quicker, we try more things, we try more individual kinds of treatments because there's no government bureaucrat deciding what you and your doctor can do about the cancer that they just found that you have.